This video is about personality disorders, which is chapter 24 in your text. You'll notice in the module there is a video downloaded, um, cla cast, cla crash course, um, which is a very good video, goes over things very well. The guy talks a whole lot very quickly, so sometimes you miss a few things, but he does a good job of kind of going through these, and which is not in your book, but he talks about the most common diagnosis for these personality disorders is personality disorder unspecified, because maybe there is a blending of several different personality disorders in the person, but um, most people who have a personality disorder, with a couple exceptions, don't even see that there's anything wrong with their thinking or behavior. And it's one of those things that are particular to them, and it is pretty stable, although you can make changes if the person is motivated to change and willing to work at that. And as we go through them, we'll kind of talk about what kind of treatment. There are no drugs that the FDA has said this will work for a personality disorder. So the treatment is to do medications that help manage the symptoms and use types of therapy dependent on what the personality disorder is. And you can see some of these traits in people that you know. If you kind of read it through them, you can say, gosh, you know, my uncle, my friend, I see some of this behavior in them. And that's not uncommon because we all have little um, characteristics that are a little are specific to us and maybe a little different than what some other people see. So these personality disorders are divided into clusters. So this is cluster A. These are the people that are odd or eccentric. So there are three different ones: paranoid, schizoid, and schizotypal. Paranoid people are suspicious of the motives of others, assume that others are going to harm them, exploit them, or deceive them. And these are the people that leave their money in their mattress because they don't trust the bank. Um, Treatment for these: some individual therapy, some medication for anxiety or psychosis if they're really paranoid about something. The schizoid person is withdrawn, has little need or desire for emotional ties. This is the person who lives alone, never married, has no children, maybe works nights because he doesn't want to interact with a lot of people. So they work at a job where that's not necessary to do. Treatment for this would be psychotherapy and possibly antidepressants. Then the schizotypal people, they have odd and eccentric behaviors. They're isolated and they have magical thinking. Magical thinking is normal when you're a very small child, and that's magical thinking. It's just thinking, I can think something and make it happen. Illusions, which are you misinterpret the things that you see. And if these people are under a lot of stress, you may see them decompensate to being very psychotic. So treatment for them is supportive care and antipsychotic medications. Problems with treatment for these people is they are paranoid and distrustful, all of them. So getting them into treatment is problematic. Cluster B is the dramatic, emotional, or erratic people. We are going to talk about antisocial and borderline individually, so we'll do that later. Histrionic, these people are dramatic, extroverted, emotional, and they need the acceptance of others. Um, Treatment could be with group therapy. They enjoy groups because they are extroverted and uh, dramatic, and they may be helped by antidepressant or anti-anxiety medications. Then the narcissistic person. They have an exaggerated sense of their own self-worth, really can't appreciate the needs of others related to what their own needs are, um, which may cause problems with the people that they interact with. So treatment for this person, if they were willing, would be group therapy, family therapy, CBT, cognitive behavioral therapy, um, medications for mood swings or antidepressants. And then the cluster C people. So these people are avoidant, dependent, or obsessive. So the avoidant people are shy. They fear rejection. Um, their need for acceptance may lead them to withdraw. So they may not do things because they're concerned that maybe people won't like them, they won't accept them. So maybe they don't go to parties, maybe they don't go to group things. Treatment for them, group and individual therapy, and then medications for anxiety or depression. Dependent people. These are people who are submissive. They're dependent on others to make their decisions, and they're willing to demean themselves for acceptance from someone else. This can put a person in a very vulnerable position for someone who maybe is abusive or enjoys someone who will do anything that they say. Treatment, psychotherapy, CBT again, cognitive behavioral therapy, and then medications for anxiety or depression. Then the obsessive compulsive people. Now this is a obsessive compulsive personality disorder, which is totally different than the obsessive compulsive disorder. This is um, people who are very preoccupied with rules and order, afraid of making mistakes, inflexible. They like things the way they want them. And if their order is disturbed, it can increase their anxiety. These are people who maybe line up their clothes according to colors. They're not comfortable if their house isn't clean. This is not to the extent that the disorder is where it's very debilitating. Um, if this person is interested in treatment, group and individual therapy can be helpful, and then medications for depression or anxiety. In your text, look at page 459 and 460, and this talks about the cognitive factors that may lead to someone to have a personality disorder. Developmental milestones that people need to meet in order to move on with their personal development. And if those are not met, then that may be an issue. And then treatments. Um, Borderline personality disorder is what we're talking about here. Sorry. So CBT, cognitive behavioral therapy, learning how to look at your thoughts and analyze them and changing your behavior by changing the way that you think about something. The DBT is kind of cognitive behavioral therapy and then behavioral methods with mindfulness. So being aware of what they're thinking and making changes to that way of thinking. Medications for depression, second generation antipsychotics for anger, and naltrexone, which we use for addiction, can reduce the possibility for self-injury. borderline personality disorder usually has another mental health diagnosis. Commonly, it's depression associated with it. And these are the people you are more likely to see in an inpatient setting because of um, the behaviors that they show. So this is just a little slide that talks about um, the borderline personality disorder. They, because of the symptoms of the disorder, they are more likely to be hospitalized. They're emotionally labile. They have depression. They're impulsive. They do self-destructive behaviors, cutting, burning themselves, um, promiscuous sex, um, substance abuse. And then they have relationship issues due to their feelings of abandonment. And because they are impulsive and labile, um, a lot of times those relationship issues cause them to show other symptoms, which can cause a problem in that relationship because of their behaviors. So, a good nursing diagnosis. There's some others in your book, but risk for violence, self-directed, and because of these feelings and the symptoms that you see. They may talk about suicide, they may cut themselves, they may take an overdose, run away, drinking, drug abuse, promiscuity. And they also can change very quickly because of this impulsivity. Maybe they feel this way for a minute and then it changes to something else. So it's very difficult to kind of keep up with the um, changes. A couple of behaviors that you'll see, splitting, that is most often seen in the borderline personality disorder, and it's simply the inability to see things as either as good and bad. It has to be either or. Um, in healthcare, if you're a staff who they see as good, then they will be cooperative with you. But if you do something like enforce a rule, not allow them to have extra phone time, something like that, then they would see you as bad because you enforced a rule. And this happens with relationships. These people will create their own problems in their relationship by making judgments without checking with the other person. So maybe they've had a fight with their significant other and they have done something to harm themselves. They've cut themselves or threatened suicide. 10 minutes later, this significant other may come with them and they may have talked and okay, everything's okay now. So it's very impulsive and it's this way or it's that way. And part of um, the therapy for them is that cognitive behavioral therapy to have them look at how they're feeling and make the decision, is this really what's happening? My friend and I had an argument. Does that mean that's the end of our relationship? No, maybe not. Maybe we just need to talk more. But they don't see that. It's, we've had a fight, relationship's over. So I'm going to do something to hurt myself. And then manipulation. You're going to see this in the borderline personality disorder, and you're going to see it in the antisocial disorder. So manipulation is just doing what you need to do in order to get what you want. And any behavior is okay for that because you want to achieve what you want to happen. And this last slide is about antisocial personality disorder. Um, you very seldom see someone with an antisocial personality disorder in healthcare. because they really don't see that there is anything wrong with them. But they may come in because there's been an event that's caused them to be depressed or suicidal, or the court has ordered them to be evaluated because of their behaviors, or they're trying to avoid a legal situation. Often this disorder starts in childhood, and when we talk about child and adolescence, we'll talk about conduct disorder. And that's why we need to treat conduct disorder in children so it does not follow through to antisocial personality disorder. We believe that there are genetic and familial factors here, also social factors, and possibly abuse. We do find a lot of these people in prison, in jail, and on the streets just simply because of this disorder and their inability to um, follow rules that do not please them. So these people are very charming. They're pleasant, friendly, manipulative, as long as they're getting what they want. If not, they can be angry, hostile, and violent. And the rules that society puts forth, they really don't feel like they pertain to them. And if they break rules or injure anyone else, they don't really have any feelings of remorse. So treatment for these people, um, medication for symptoms that you might see, mood stabilizers, antidepressants. And if the person can see that there is a problem, group and individual therapy can be helpful for them. And then think about what kind of a nursing diagnosis would you choose for a person with an antisocial disorder.